Hey everybody, Judy Seeger here, back with another episode of the Ozone Therapy Summit. So glad to have you guys back. And as always, we have experts that are going to teach you all about ozone therapy. But this time, of course, we have sections for our furry pets that we absolutely love at home. And so we have our special guest today, Dr. Cheryl Caputo. Thank you so much for being on here today.
Great. Thank you for inviting me. I'm glad to be here.
Yeah, and I'm excited because I love having pets, and because of travel, I don't have them right now. And it's always an issue about taking care of them properly and all that. So this is going to be another fun interview, and I'm really looking forward to it with you. Dr. Caputo, you have been a veterinarian now for how long?
Well, it's been about over 30 years. I graduated in 1978 from The Ohio State University.
Wow. And so your practice was up there, or was it down here?
I did an internal medicine residency first, and then I actually opened a practice in Virginia.
Wow. So, yeah, and your specialty is dogs and cats, correct?
Correct, dogs and cats.
Awesome. So we've had a few vets already on, and it's always fun to talk about how you guys have gone conventional and then use ozone. So as always, we'd like to start out all our experts by asking, first of all, what is ozone? Explain it in your own words. And what are the benefits that you've seen it being used in your practice?
Good. Well, I mean, ozone is a therapy. It's a natural biologic therapy. When you think about the body, one of the main critical components of the body is oxygen. The body has to have oxygen. And so what we try to do is give it more oxygen and to enhance cellular energy that produces oxygen. So ozone is, we know that oxygen is 2 molecules, and then when you send a current, electrical current through it, it breaks those molecules apart, and then they reconfigure themselves. Many of them combine as O3, which is ozone, and some of them recombine as O2. So O3 is not a very stable molecule, so you have to use ozone very quickly. So whether we make it up in with fluids or inject it into the body, it gets used very fast.
That's about as basic as you could get. So how did you see the benefits? Well, let me ask you this. So you were doing conventional veterinary work for all those years. What made you decide to get into ozone therapy?
Well, let me back up a little bit because we're all trained conventionally. And then I actually did an internal medicine residency, so I was very trained in the conventional side. And then once you get out and you practice, you help some animals, and there's some that just don't respond the way you'd like to respond. So I started looking for other answers, and that opened up the whole area of holistic medicine, whether it be homeopathy, Western herbs, Chinese herbs, acupuncture, chiropractic. I mean, just once you start to look, you find a lot of things. And I happened to have gone to a conference, and I think it was actually Dr. Margot Roman who was speaking on ozone therapy. It was very new at the time. And I said, you know, that's what I need to look into because it's just so elemental. It's just so basic. The body needs oxygen. I mean, the body is an amazing organism, and it should function such that it takes care of all these foreign invaders that we present to it, whether it is pathogens, bacteria, viruses, whether it's environmental toxins, whether it's food preservatives, whatever it is. A well-functioning body should be able to handle those things. But because of the world that we live in and because our bodies are not at their optimum functioning level, they don't handle it, okay? Cancer for one, there's cancer cells in everyone, and the body should be able to find those cancer cells and kill those cancer cells. In a very well-functioning body, it does that. So basically what I like to try to do is give the body what it needs. If you had a broken car, you wouldn't put some abnormal part into it. So if you have a broken body, you want to give the body what it normally needs, oxygen, vitamins, things like that, so that the body can basically do its job. So yes, I started using ozone therapy, and I use it predominantly for cancer patients. Ozone therapy is not something that I use alone. I don't think ozone therapy alone is an adequate therapy. It's an adjunctive therapy. So we use it with acupuncture. We use it with Chinese herbs. I use it with supplements because I try to do as much as I can do for these pets that are suffering from cancer. I also use it in dogs and cats that have autoimmune diseases. It's very good for infections because ozone by nature kills bacteria, funguses, viruses, parasites. And the nice thing about it is because it's biologic, it does not cause any resistance. So we don't have problems with bacteria that are resistant to ozone. I mean, there are so many uses for it because anytime you're putting oxygen into the body, you're helping the body and you're helping the body to function better. And you're helping it at a cellular level where the oxygen actually gets into the cells, gets into the mitochondria, which, as we probably remember from biology, are the little powerhouses of every cell. So mitochondria need oxygen, and ozone gets into the cellular membrane, it gets into the mitochondria, and it makes the mitochondria function as well as it can function to generate more energy for the body, so the body can then try to heal itself.
Yeah, and I love the science that all you docs, we had Dr. Rowan on here as well, and everybody's explaining that science, and it's so important to understand that because then you know better how to get your immune system strong enough and how this whole process works. And you brought up a really important point that I want to go back to, Dr. Caputo, which is that you have to use this with other therapies and diet and all that stuff. And you mentioned acupuncture, homeopathy, herbs, and all those things are very helpful. But let's go back to the basics because you deal a lot with cancer in the animals. First off, in your opinion, because you've been at this for a long time, why do you think these pets are getting cancer? I mean, we have some theories with humans, right? But why do you think the pets are getting it? Because they don't have the same stress, do they? They don't have the same issues that we do. So I'm just, from your perspective, why do you think that's happening?
Well, I think it's multifactorial. Basically, genetics plays a big role. We have very popular breeds that get overbred and inbred, and then their genetic deficiencies get exemplified. So we have some abnormal, weak genetic animals to begin with. Stressors, yeah, sure, they've got stressors just like we do. You know, stress of living in the household. Animals will actually even try to take the stress that their owners have. They'll try to take it away from them, whether it be an illness or a stress or an emotional upset. But yes, they have emotional stressors. They have physical injury stressors. So yeah, their body has stressors as well that they deal with. And then the world we live in has a lot of pollution, so to speak. We take into the body preservatives, pesticides, herbicides, the foods that are produced, like a lot of the commercial foods, they're dead food. They're just not nutritious for the body, and the body needs nutrition to function normally and to heal. So those sorts of things just become too much for the body. The body can handle so many things coming at it, but if it's dealing with a low immune system to begin with, and then it gets bombarded with all these other environmental and external pathogens, it ends up creating cancer.
Yeah, and so that, yeah, you're absolutely right. It just comes from different perspectives, and people, I don't think, realize how much our pets are getting affected by it. And so you do the holistic approach. And so let's talk first of course, about how you've seen the ozone therapy work in your practice. First off, how do you apply it to the pets? It's always interesting to hear that part.
Yeah, so there's many different ways to deliver ozone therapy. In contrast to people, the most popular route of administration is by rectal insufflation, where the gas just goes straight into the rectum. Now, that the dogs tolerate that well, and the fact that it gets absorbed very quickly. There's a great big vein that's very close to the rectum that goes straight to the liver. So I use it very much for liver conditions. We see a lot of liver problems in animals as well as kidney problems. And then it gets distributed throughout the body. So rectal insufflation is probably my primary route, but you can take ozone, you can take saline fluids, and ozonate them and use them under the skin, what we call subcutaneous administration. There are many, like older cats with kidney disease, that need extra fluids in their body. So rather than just giving them a balanced electrolyte solution, you can give them ozonated saline, and that gives them a little boost there. You can put ozone into joints with some other substances to help, like with cruciate ruptures, different injuries in the knee. You can inject ozone, and I have done it directly into like a soft tissue tumor. Tumors and cancers, as we know, do not like oxygen. And so if you put the oxygen straight into a tumor, I've actually documented the decrease in size in the tumors. You can also give it in fluids right into the vein intravenously. Now, as a house call practice, that gets a little more complicated for me. That would be more for someone with a clinic. So I use rectal ozone quite a bit, and I had listened to one of the ozone conference researchers who said they compared actually rectal ozone delivery to what's called major autohemotherapy, where the blood is taken out of the body, ozonated, and put back in, and found that rectal ozone was pretty equally effective to that sort of a delivery. So I've
heard that too. No, I definitely heard that too. But here's really the bottom line. As a clinician, as you know and I know, we go to these conferences, we hear these things, the studies, but then we come home and use it in our clinic and see the results. So what are some examples, or tell us the results that you're seeing as you're doing the rectal insufflation on your animals?
Sure. Well, I mean, overall, it's interesting because I try not to tell the clients what to expect. I say, I want you to just observe and you tell me what you see. For most of them, especially the cancer patients, the comment comes up, they're like a puppy again. It's like they've got energy. I have one little dog that as soon as I finish the rectal delivery, he runs outside and he just runs laps around their swimming pool.
That must be so cute.
And I have another little dog that's a 3-legged dog. She had one of her rear legs removed because of the cancer. And I mean, they had given her a very short time to live, and she's now out like 8 years. They can't find any more cancer. We do ozone therapy and acupuncture on a regular basis. And she's just such a happy little dog. And again, they're one of the ones that said she's like a puppy again. So it's a wonderful.
So the energy goes up immediately. That's, yeah. And with people too, typically that they get their energy raised up. Now when you are working with the animals, do you have them, like, because some of them I'm sure have had conventional treatment, right? So do you wait until that's all done, or do you jump in there and just educate the owner about using the ozone therapy, or use it and integrate it with conventional? How do you do that?
Well, that's a good question, because many of the clients come to holistic practitioners when they've tried everything else. Or they get the diagnosis of cancer, they've gone to the oncologist, and the oncologist wants to do chemotherapy, radiation therapy, and the client is just, no, I don't want to go that route, okay? So then they look for a holistic practitioner. So that's where it comes in. But the beauty of ozone is it can be used with conventional therapy as well. There's a benefit to using both together. I've done many.
Okay, wait, now hold on. Let me jump in, because that was misinformation for me until I spoke with some of the other docs. Dr. Rowan, Dr. Robbins said the same thing. Now with animals, let's just go in here a little bit, because you're one of the people who really focus on the cancer, right? So if the animal is on chemo, right? Let's just say it has to have like 6 treatments, and you use ozone. Explain it to us. How does that work, ozone and chemo, and not conflicting?
Well, basically, I've had many of them that have done chemotherapy, and then we do ozone therapy. What I find is that the ozone therapy helps the body to heal. Yes, chemotherapy sort of drags them down, because it's actually killing cells. It's actually another toxin into the body. So it's sort of a balance. They may be knocked down some with the chemotherapy, but then the ozone brings them back up to another level. So yes, I use it together, because I can't tell them don't use chemotherapy. If they want to use chemotherapy, that's certainly their choice. There are some people who do, there are others who don't.
But obviously it's better if they're done with chemo. But you're saying there's no conflict. It's fine if they decide to do chemo with ozone, they could do it. They're not going to think it is the same benefits, obviously. But if that's what they choose to do, that's what they choose to do.
Yes, yeah, they can do it together. And you bring up a good point, because oftentimes when they go through a round of chemotherapy, it's like, okay, I'm finished with this, now what? That's the important time to do ozone therapy. Now you need to help the body heal, not only from the disease process, but from the damage that the chemotherapy may have done to the normal cells. Because chemotherapy is, yes, it's attacking the tumor cells, but it's also doing damage to the normal cells, whether it's the intestinal tract or whatever. And as we know, the intestinal tract is so important for the immune system. And so many of the chemotherapy drugs attack rapidly reproducing cells, which happen to be some of the cells in the gut as well. So yes, ozone therapy is like exceptionally important after the chemotherapy is done.
How about with radiation therapy? Once they're done with that, or even using, let's just go into it. Let's say they're on still radiation treatments and then they want to do ozone. How does that work together?
It works together fine. I've not had any trouble with it. There'll be some oncologists who may put up a little bit of a protest and say, no, I don't want any other therapy when I'm doing this, and I just have to respect that.
Right. So that brings up something that I was always curious about working with animals, is that if the oncologist says, well, you shouldn't use anything with chemo or anything with radiation, which is typically what they say, does the owner still say, well, no, I want to do other things? Or I'm looking to see, is that oncologist really resisting so much that the owner says no, or do they go ahead and do both?
Well, as you know, it varies with the client. There are some clients who are very set on, this is what I'm going to do, and this is what I've researched, and this is what I know I want to do. There are others who think that the medicos, the medical doctors know it all, and they're going to listen to them. Now, I have to respect.
So yeah, either way, yeah. So that, just so we're explaining that it's safe and it is a choice. We're not saying anything about, it's only ozone and that's it. No, it's really a matter of choice. So I'm really glad you clarified that. Thank you so much. So then, as far as then after the chemo radiation is done, typically, and I know it depends on the animal, so maybe you could give us some examples. Typically, how many sessions do they need to do ozone? And how soon do they see results after? Because with chemo and radiation, they're really down, right? And do you see them pick up, or is it just takes a while for them to get the results?
Well, ozone therapy is cumulative, so the more sessions, the better. It just helps the mitochondria build up more mitochondria, more energy producing capability. So the more ozone you do, session-wise, the better. So normally I will say, okay, I want to do 4 weeks, once a week for 4 weeks. And then I sort of reassess, how are they doing with it? Are they improving? Are they staying the same? Whatever. The cancer patients, I normally keep on either weekly or every other week. If they're doing very, very well, like the little dog with the 3 legs, she goes back to their regular referral hospital every 6 months, gets CAT scan, gets blood work done, and they were not finding anything. So with that particular dog, I said, let's do it every month. We do every month. So we've done every month for the last year or so, and that little dog is still doing well. So it just depends on the patient. We try to individualize the treatment to that patient. So it's a little bit different with each one. And then there's other ones, like I had an infected toe where there was 2 surgeons who absolutely wanted to take this dog's toe off. And the client is like, no, I don't want to take it off. We did ozone therapy on that toe every day for several days in a row, and actually cleared up the infection, and the dog saved the toe. So.
Wow, that's just through basically the rectal insufflations is what you're doing.
That one, because it was a localized area, that I actually just treated that area. So I guess one of the ways that I did forget to mention is you can actually bag or use a glass cup over an area and concentrate the ozone in that particular spot. And that's what I did with that dog's infected toe.
Yeah, we talk about that with people too, is you could put the bag over the limbs and use it for different things. So that's an easy way to get it in and through the ears and all that. So that's really great. The types of cancer, just in general, what types of cancer, because I don't know with the animals, typically what type of cancers do you have to deal with?
Dogs have probably the same variety that people have. We deal with cancers of the lymph system. We deal with cancers of like the spleen and the liver. Right now I'm treating a little dog with colon cancer, so similar to what people get. Cancers of the limbs, cancers of the soft tissue like lumps and bumps. So it's pretty big variety of different types of cancers. It just depends on which cells decide to go crazy and reproduce.
Right. And then when you use the ozone therapy, do you notice that it's more effective for certain types of cancer, or is it pretty much the same?
I wouldn't say that it's more effective for one versus the other. I would say because it's a general immune upregulating system, basically you're taking the body's immune systems and you're upregulating, you're making them function to a higher level. It pretty much universally helps them all.
Excellent. So that way, because I know people will ask, well, what about for this cancer and what about for that? And it's, yeah, I agree with you. It's really a nice adjunct for all of it. Okay, so as far as, let's go into a little bit with the other adjuncts that you were mentioning, acupuncture and all that. Do you do all those? Do you do all the different therapies, or do you just focus on certain ones?
I primarily use the ozone and then acupuncture, Chinese herbs. I use a lot of nutritional supplements. I do a lot of consultation on nutrition because nutrition is absolutely important for the body. As I said, I mean, many of the processed foods are just dead foods. They're wonderfully convenient to throw down in a bowl and a dog or a cat eat them, but they are not the nutrition that that pet needs, especially if the body's in some sort of a compromised situation. It needs live food, just like people. You know, we need vegetables, we need meats, we need things that have life to them. I am trained in homeopathy as well, so I'll use homeopathy. Each case I sort of look at as an individual and come up with a customized plan for that particular patient.
Excellent. So when you customize it and you put it together, and you're using the ozone therapy with that, how long with that and the nutrition and all that does the owner realize that they have to put this all together? Because so many times I know in my clinic, they just give me the one thing that's going to make the difference and get me the results, because like you say, they've done all these different things already. So there must be some patient education as well for them to understand the whole picture. Is that, or do they come in already knowing this stuff?
There's a lot of education that needs to be done, although I'm very impressed with many of the holistic clients, how much research they do. And with the internet now, the information is out there. So they will even come with some ideas that I haven't even heard of. So you have to work with each one between their work schedules and their finances. You know, what can they do? We look at the ideal and then we look at what can be done.
Sure, no, that's right. And yeah, you're right. They are getting a lot smarter, and that helps a lot because then we work as a team. So that works nicely. Okay, so that's cancer part. Do you work other things, other kind of conditions, like anything from Lyme's, arthritis, that kind of stuff as far as disease goes, or is it predominantly cancer?
The ozone is predominantly cancer, but like I said, with that toe, I mean, I treat infections. I have dogs that have autoimmune disease that I treat with ozone as well. Arthritis type situations, I probably use the acupuncture more than I use ozone, but basically any geriatric animal that might be having arthritic conditions can benefit from ozone. Any animal in general can benefit from ozone. I have actually a young dog that had a huge tonsils. It had a tonsil infection. The dog could hardly eat or swallow. Its tonsils were so big. And you had mentioned I also do. I have a little stethoscope that I can put in their ears.
Oh, okay.
And so
that must be cute. A little dog with this big stethoscope.
Run it right into their ears. So
and they tolerate that, do they?
They do, yeah. But you can treat ear infections. That dog, because the inner ear goes right back to the throat, I used it to treat the tonsils, and we got the tonsils to come down. And that dog is doing very well now. But she knows, the owner knows, that this dog has some immune issues because he's a young dog. So we're continuing to do ozone therapy rectally every month.
Right. See, so that's what I was going to ask you. So if it's throat or something in the head or anything upper, you use the stethoscope. If it's the rest of the body, then you're using the insufflation. Is that right?
Yeah, it depends on what area I'm treating, right?
Yeah, and you don't do any injections at all?
I have done some. It's just that it doesn't lend itself well to a house call practice.
Yes, because you're not in a clinic setting, you're in a house call. So which is really very comfortable. I mean, I've seen some great clinics in these interviews, but it's also very comfortable to be in a house and just let the owner relax. And then I'm sure the pets relax too, yeah?
Absolutely. I mean, the home delivery, people are very happy with it. The animals are just laying in their bed. They're happy there. They're comfortable. It's not a noisy clinic. It's not where they have to get in the car and go somewhere and they get to the point where it's like, I don't want to go there anymore. So it's a nice setting. I'm very pleased. It certainly limits what I can do. I do work with another hospital that if I have to bring them into the hospital, I can do ozone therapy there and do some of the.
Yeah. And just one more question, and then we'll wrap up. The infections, because I know that I see a lot of people that struggle with, they're afraid of the infections getting really out of hand, anything from MRSA to, all kinds of infectious diseases. And so for animals, I'm thinking, it's the same thing. They want fast results. So how quickly, if they do have an infection and, they're licking it and they're obviously, irritated and in pain with it, how soon, if they've done the ozone, do you see that at least they get some relief so it's not so red and infected for them?
Yeah, again, that's variable, like the Great Dane with the infected toe. I mean, we did that for about 4 days in a row and then did it for a couple weeks and that was all cleared up. The other ones, if they are continuing to traumatize areas, they're licking, they're biting, whatever, they keep traumatizing the skin, and then that makes it vulnerable to infection, so it takes a little bit longer to clear up. So if we can stop the underlying whatever sensation they're feeling, whether it's itching or burning or whatever, and get them to leave their skin alone, and then the infection will go away quicker. Thinking of infection too, I just had a really old coon dog that was diabetic and ended up with a big decubital ulcer on its hip. And the veterinarians had treated it with antibiotics and it hadn't gone away. And so that one, I actually ozonated the saline and injected all around that decubital ulcer and then used the ozonated olive oil on it because they were culturing nasty bacteria out of there. And within 5 weeks, 5 treatments, that thing was almost gone.
Wow. The ozonated olive oil, I forgot about that. Yeah, that for them would be great because if you could put a collar on them so they can't get to it, and then you could put ozonated olive oil. Do they have to apply it on a regular basis?
Yeah. Probably once a day at least.
Oh, okay. Once a day. Okay. So it's not like a lot of work. It's just putting that on. And then they see the result and they probably feel better too. It's not irritated as much.
Yeah, it stays nice and moist and gives it a chance to heal.
Yeah, that's a nice combo actually. And can you use that on their gums as well?
You can. It doesn't taste very good, but you can use it.
Yeah, I know with people we do. I don't like the taste either, but I'm thinking with animals, they don't care as much. So you could put it on and swallow it and, whatever. It doesn't hurt them. That's the good thing is with ozone therapy, it can't hurt them. Right. So that's the bottom line. So you are located where, Dr. Caputo?
I'm in Clearwater, Florida.
Okay, which is so those who don't know, that is on the west side of Florida, kind of near Tampa, yeah. And not that far. And so your website is
pethealthalternatives.com.
Okay, so we'll have all that information on the bottom of the interview and your details of how people, if they want to come in for a trip, because I know a lot of times people come down here to Florida for vacation and they have any issues with their animals, we're going to send them over to you. Not that you want to get world famous busy, but those who want to know or talk to you, that would be a great way to just kind of get their feet in the door as far as knowing about it, because a lot of people don't even know the power of using ozone for their pets, and it's very important to understand that. They also put, like, if they have the infection, I was just thinking, like, the bag, like if they're little animals, little pets, over their body. Have you done that?
I've done whole bagging where you put the whole animal in the bag, yes.
And they tolerate that too. Yeah.
Some
we need to see,
better than others.
Yeah, we need to see the pictures of that. Yeah, I mean, I'm sure some, depending on their personality, it would be a little bit claustrophobic, I'm sure, with some of them, right?
But I mean, their head is out, so it's not too bad of a big deal. But the website, my website has a lot of information on ozone therapy. The other thing that we use in conjunction with ozone therapy that I know they're starting to use in people more is the fecal transplants, microbiome restorative therapy. Have you done any?
We had Dr. Ramon on there who explained she does that quite a bit. And that's a very different, actually a couple of the other doctors do too, but she's really into that. Have you done that as well?
I have, yes.
And you found success with that?
Yes.
Okay, so just because it's a different day of this summit, can you explain in your own words, what is that process?
Basically, and I bring it up only because we do ozone therapy before we actually put the transplant. So as we know, the intestinal tract is a major area of the immune system. So if you have, you want to have as healthy of an intestinal tract as you can, and that would include the normal bacteria and funguses that live there. So if they are wiped out by overuse of antibiotics, then we repopulate the intestinal tract with good bacteria. So we actually take stool from a very healthy dog, one that's had very few, if any, vaccines or drugs. We actually use Dr. Margot Roman's dog's species. He sells it so that we can use it in other patients to sort of repopulate that intestinal tract to make it healthier. So that's the basis of microbiome restorative therapy, MBRT.
So that whole procedure is actually a surgery then, correct?
Not a surgery.
Oh.
It's the same as delivering ozone. When I do the ozone therapy, I just leave the catheter in the rectum. I mix up the solution of stool and saline and just inject it in.
Okay, so that combo you're seeing good results with, is what you're saying?
For certain cases, yeah.
Yeah, and the main thing I think people need to focus on, a couple of things, is that you said it's a multifaceted approach. You know, using acupuncture, homeopathy, ozone, good nutrition is very, very important to do, and understanding that whole perspective. But also understanding that the gut health is so, so important. Absolutely. People need to, whether it's humans or animals, they need to take care of themselves. It's a big, big issue. And so when the animals are eating better, the owners eat better. When the owners eat better, the animals eat better. It kind of goes hand in hand. So we're educating them on both ends.
That's right.
Yeah, very important. Dr. Caputo, thank you so much for your time. And I know there'll be lots of questions on here, and we'll get those all to you. And we'll make sure that they get the video with your description of where your website is so they could get more information. So appreciate your time. Thank you so much.
Thank you.